Hi, I'm Dr. Robert Cywes. My website is obesityunderstood.com, and this short video is going to discuss a very powerful but incorrect concept that is pervasive in our society and is probably one of the most common reasons why people fail to lose weight and keep it off, and instead remain on a bunch of ridiculous medications to treat diseases that will never go away because they don't understand the cause. And what I want to talk about is what is the cause of obesity and how does obesity relate to other diseases such as diabetes, hypertension, sleep apnea, polycystic ovarian disease, breast cancer, bad cholesterol. I want to clear up a strongly held myth. Most people believe that obesity causes diabetes, that obesity causes hypertension, that obesity causes bad cholesterol, and therefore is responsible for heart attacks and strokes. That is absolutely 100% incorrect. It is just plain wrong. Obesity really doesn't cause any problems. There are two major issues that obesity does cause, but certainly nobody dies because they're fat. Nobody keels over and can't get up and just says, hey, that's it, I'm done, and dies. We do not die of obesity. The two things that obesity does cause and does directly affect are our joints. There's no question that that excess weight, you carrying an extra 100 pounds, that excess weight does put pressure on your spine, put pressure on your hip joints, put pressure on your knee joints, on your feet, and clearly the osteoarthritis of those joints is correlated in large part to obesity and to the excess weight that people are carrying. And then, from my perspective, the only other thing that obesity does is it doesn't make you look so good in the thong. Other than that, from a cosmetic perspective, obesity really doesn't harm you. So, if obesity doesn't cause diabetes, then what does? And what does cause obesity? It's very simple. Chronic, excessive carbohydrate consumption. It is the consumption of sugars and starches, and there's really no difference between sugars and starches. It doesn't matter how the drug goes in your mouth, it matters how it gets into your bloodstream. And sugars and starches directly cause type 2 diabetes, cause hypertension, and is one of the most prevalent causes of hypertension, but not the exclusive one, causes polycystic ovarian syndrome, causes obesity. So one of the things to understand is that all of these diseases are caused by sugar. What doctors do is they treat the numbers. So you reach a certain number and they call you diabetic. Prior to that, it's pre-diabetes or insulin resistance or a whole bunch of gimmicky names that people can pretend they don't have a problem. Ultimately, it doesn't matter whether you've got diabetes or not, as long as you're eating a huge amount of carbohydrates, and most heavy people are, all heavy people are, it is affecting your blood vessels. It is affecting your heart, it is affecting your blood pressure, and your risk of stroke and your risk of heart attack is going through the roof, whether you are at a treatable number or not. No doctor out there can cure diabetes with medication. The only way to put diabetes into remission is to get people to stop eating sugar and starch. And obesity is exactly the same. So obesity is associated with diabetes, but the cause is chronic excessive carbohydrate consumption. And once you understand that it's the consumption of sugar and starch in our diet that causes all of these things, then if you just lose weight, you may weigh less, but your diabetes, your hypertension, your polycystic ovarian syndrome isn't necessarily going to get better, or transiently gets better and then it comes back. But if you give up sugar, like a drug addict giving up heroin, all of those diseases get better and actually will go into remission. And the objective of our program is to treat our patients, our diabetics, our hypertensives, our obese patients, not from a weight loss perspective, but from a substance abuse perspective, where we get you to use substance abuse methodology, cognitive behavioral therapy, to address your addiction or your abuse of sugar. And if you can limit or reduce or eliminate, preferably eliminate, your carbohydrate consumption, you don't have the diseases that come from carbohydrate consumption. No different to someone who smokes and quits smoking and their lung disease risk improves, an alcoholic whose liver risk disease improves. I mean, the day you quit drinking, you are not at risk of a DUI, period. You know, that's the way that works. Same thing with diabetes. No sugar, no diabetes. Type 2 diabetes. Type 1 is a different animal. But understand, if you can make that conceptual shift away from obesity being the cause of disease and sugar being a powerful toxic drug that causes disease, then you can really begin to manage the program, manage yourself and manage a program properly, not only to lose weight to get rid of the diseases, but to keep them away. Single best way to prevent the diseases is to abstain from the consumption of sugar. And our job is to help you to do that. Thank you.